So again, welcome to this session. My name is Njiden Dili. This session has been organized by the Lancet and Financial Times Commission on Governing Health Futures 2030, Growing Up in a Digital World. I'm the country director for Farm Access Foundation, which is an international NGO headquartered in Amsterdam. And at the same time, I'm also the commissioner for the Lancet and Financial Times Commission. This commission was launched in October 2019. And the reason for that was to explore the convergence of digital health and artificial intelligence as it relates to universal health coverage. In fact, when the commission was launched, it was meant to be an interactive, we were supposed to have quite a number of meetings, but due to the COVID pandemic, we had to move all our activities online. And it has been really refreshing and quite productive to have the meeting organized this way, even though we miss the human touch. So the commission really focuses on improving and safeguarding the health and well-being of children and young people. And over the past year, we've been gathering all sorts of information from around the world with regards to young people under the age of 25. And as we know, Africa remains the continent with the highest population of young people under the age of 25. Statistics has it that 60% of the population in Africa is under 25. And it's important to understand national policies and activities within some of these countries that would enable digitally enhanced health systems, and to understand the barriers to implementation, as well as understanding the views of young people so that we can ensure that they're integrated in the discussion. So before I hand it over to Christian, Franz, and Louise Holly, who are both policy and research consultants for the Commission, I have to say happy International Women's Day to both Ilona Kirkbush and Monique Dolphin, who both lead Farm Access Foundation as well as the Commission for the amazing work they have been doing. And also the Secretariat, which has its own proportion of women that are supporting it. I think that it's time that the world recognizes the strength and the value that women bring to the table, especially with digital innovations and transformations. And it's really exciting to be part of the discussion and to hear what is going on. Also, I'm going to have, in addition to Christian and Louise, Usman and Eno, who are also physicians. They'll be joining in having some of the discussions and the dialogue. So it's really going to be an interesting session. But most importantly, we want feedback from the audience, because this is really a consultative engagement to get feedback after the report has been presented. So please, at any time, feel free to put in your comments in the chat box. I'll be referring to some of those, as well as if you prefer to listen in French, you can use the translation button at the bottom. So over to you, Holly and Christian. I don't know who is going to be leading this discussion, but over to you.
Thank you so much, Njide. And it has been a true pleasure for us to work on this together with you and shape it over time. So can I just get a short confirmation that you can see my screen?
Yes, I can.
The presentation and the pointer that is moving.
Yes.
Excellent.
So just that you have 15 minutes for this presentation, just to make sure we keep the time.
Yes, yes. Welcome everybody to this short intro presentation, I would say. And as you can see from the title, what we really did here for the Lancet Commission was to explore a specific question that was coming up in the different meetings of the Commission again and again. It's a question, where do we stand? And of course, because we could talk about governing health futures, it's a lot about the question of policies and where do these policies stand versus the de facto situation in countries. Louise and I, together with Njide and our colleague Robert, have been working hard to lay out some of the baseline facts, reach out to some of the stakeholders in different countries, and bring it all together in like really exploratory study, I would say. Let's call it a first go to hear more. And it's important to hear more from the countries that we look at. And it's really important to see this as part of a larger approach of the Lancet Commission, of going into different regions to understand a bit more how the situation in digital health for young people is, and what are maybe the barriers. So all this is part of a set of regional consultations. And in this specific case, we started with 10 African countries that you can see here listed out on the screen. And we went by, let's say, the share of people below 25 years, and selected then from all those countries in Sub-Saharan Africa, 10 countries. And to go a bit deeper in different ways. So a statistical point of view, looking at the policies on digital health that have been coming up over the past years, and the last portion speaking to key informants. And as I said, this is a starting point for us. It was a very small team working on this, and of course we only spoke to relatively few people. So a bit more than a dozen of people. So of course this cannot be representative. Nevertheless, we think there are some few interesting aspects that can also guide this discussion and allow us to hear more from you. And I think as a background note, it is important to have an idea that a lot of things are happening in Sub-Saharan Africa around the digital transformation in health. Not only are policymakers focusing more and more, the African Union's digital transformation strategy, for example, highlights digital health as one of the key transformative sectors. I don't need to say much about how COVID-19 has definitely shifted our view, I would say, and willingness to engage with these technologies in a tremendous way. And then we also see that over the past 10 years, there has been a tremendous uptick in research interest on the topic. So I'm happy later to go more into detail here, but these are just three elements that drive that change. Not to speak of the meta dynamics. I think the digital economy in Sub-Saharan Africa is an extremely hot topic in the business and innovation field, but also beyond. And you can see here from the second bullet point, the WHO has tried, the regional office of WHO for that matter, has tried to leverage this kind of innovation landscape over the past years. Let me dive into, you will see that from the next couple of slides, I am a data person. I love charts, and I will try to drag you comfortably through these charts. So what we can look at here is a mobile phone subscription that everyone of you here knows that there has been an immense development across countries in Sub-Saharan Africa. But for the 10 countries we looked at here, what you can see here in the green line, this one here, is the Sub-Saharan African average. And the blue line is the respective country development. And wherever you have a red shaded area, basically the country development, as far as the data goes at least, lags behind the regional average. And we can see quite a different picture here, with Cameroon, with Nigeria, Tanzania developing roughly along the average, Mali outperforming the average quite immensely, and the other countries well, Liberia also largely in line with the average, and the other countries lagging a bit behind. Of course, that is only part of the picture. The other picture, and here you see basically the same chart with percentage of people using the internet. And I think it's important to appreciate here that we have of 100% possible people using the internet based on survey data, by the way. We have like a regional average, again, the green line, which is, which is basically roughly at 25%, a bit lower. So we have a much slower uptick in the internet penetration across those countries. Let me go to the next slide, and let me also then lead to Louise, because what we saw from the last bit of slides was a tremendous dynamic, quite a different development. And what we cannot forget is also the national figures only tell you that much. The regional differences within countries are there too, and are of course hidden by those national averages. So we went into each country and looked at the digital strategies, what was done from a policy point of view. And maybe Louise, you can take it over from here.
Okay, thank you, Christian, and greetings from me as well on behalf of the Secretariat of the Commission. So I'm going to just speak a bit about the analysis we've done of digital health strategies and some of the key findings of some interviews that we conducted. So firstly, just to say, why are we looking at digital health strategies? Well, the Commission has been taking a keen interest in digital health strategies, not just from Africa, but from around the world, because they help provide us with a lot of information about the approach that a government, a country is taking to the digital transformation of health systems. These strategies tell us a lot about what the priorities of a country are, the starting points for many countries, and also where they want to get to. So there's a lot of information contained within these strategies. Of course, they only tell us about the situation when the strategy was developed, and this is a very fast moving field, and I'm sure the situation on the ground, has always changed since the publication of the strategy, so we're aware of that. But if we can move to the next slide, please. We've decided to focus on these 10 strategies for this presentation for the reasons that Christian outlined. These are 10 countries with high populations of young people. And when we were looking at these strategies and other ones from other regions, we sort of had 5 questions in mind. The first question is, what kind of strategy does a country have to guide the digital transformation of the health system? Looking at the content of the strategy, what level of digital transformation is the strategy focused on? Are children and youth considered in the strategy? That's important for this Commission for the reasons that Njide outlined, that the Commission has a strong focus on children and young people. To what extent does the strategy highlight what I'm calling here some foundational entry points, some key values and principles that I'll speak about it shortly? And then thirdly, we were looking at what kind of issues related to governance of digital health does the strategy focus on? So next slide, please. So here we have again the 10 strategies that we looked at most closely. These are, we believe, the most current digital health strategies for these 10 countries. And if anyone here is aware of anything more current, then please do share with us, because it was often quite challenging to find these strategies, through publicly available sources. So you see here that all of the 10 countries that we looked at had a strategy that covered the research year, which was last year, 2020. Mali was the only one of the 10 countries that strategy was perhaps a little outdated, although we were told that a new strategy is under development. And you can see even just from looking at the titles of the strategies that, there's different terminology used. Some are digital health strategies, some informatics, some e-health, which sometimes corresponds with the dates that they were published and the sort of change in terminology. So next slide, please. So we saw that across these 10 different strategies, they were obviously all coming from very different contexts and developed through different processes, but they had a lot in common. All 10 of them had a really strong emphasis on strengthening health information systems. And all of the strategies recognise that digital technologies are essential now for improving the efficiency and effectiveness of health services. They help to generate and analyse better quality data, and they help to build the capacity of the health workforce to do their job more effectively. And so all the strategies had a focus on information systems, but they all outline plans around using telemedicine, mHealth and eHealth tools to improve the coverage and quality of health services. There were sort of some notable differences, which I can only kind of highlight a few, but for example, Tanzania's was the only strategy that made a reference to the role of emerging technologies like artificial intelligence. Nigeria's was unique in that it talked about the role of ICT to support the financial coverage dimension of UHC. And Ethiopia, for example, had a really strong focus on transforming health systems at the district level through their Connected Warrior program. So that's just a few examples. Next, please. So in looking at the question of to what extent were children and youth considered in the strategy, to say that all 10 strategies were aligned to, were developed to support the implementation of a much broader national which prioritised newborn, child and adolescent health. So these issues are priorities for all of these 10 countries. And a couple of the strategy, well, a few of the strategies did mention that digital health and data would be used to improve child and adolescent health outcomes. In many of the strategies, the sort of landscape analysis at the beginning or the introductions noted the very high youth population in those countries, and often sort of noted that this was a huge opportunity for the country in terms of greater rollout of digital technologies, uptake of digital technologies and future innovations. But overall, none of the digital health strategies really went into any depth in considering sort of children and youth in either the development of the strategy or the sort of the implementation of the strategy. So none of them looked in any depth at the particular needs that young people might have, any of the risks in relation to digital transformation or use of young people's data. So there were no sort of special considerations about the protection of young people's data, for example. So next slide, please. So here we looked at some of the issues that have been guiding a lot of the Commission's work. As Njide and Christian mentioned, the Commission's focus is on how digital technology and data can support the implementation of and the achievement of universal health coverage. And we found that 9 out of 10 strategies very strongly sort of directed the digital health strategy in support of the achievement of the country's broader goal around universal health coverage. And I think Mali's only didn't do that very explicitly because it was published before the adoption of the SDGs. And so the Commission has been really interested in how the sort of core values and principles that underpin universal health coverage can then be applied to the digital transformation of health systems. So to achieve UHC, we need to focus on things like equity and ethics and human rights, inclusion, solidarity, and the empowerment and enfranchisement of communities. And so you can see here that equity was a very, very strong principle that was very explicitly outlined in all of the digital health strategies around using technology and data to reduce inequities in health outcomes and coverage. But for some of the other sort of values and principles that the Commission's been exploring, there was sort of a lower level of emphasis. For example, only 2 strategies talked about taking a human rights approach to digital transformation. Next, please. And in relation to questions around governance of digital health and data, I've only really got time to say that all of the strategies noted some gaps here, the gaps in legislation and regulation around digital health and data. And all of the strategies sort of indicated objectives and activities around closing some of those governance gaps. Next, please. So now just to say a little bit about some of the key themes that came through our expert interviews. As Christian mentioned, due to challenges with COVID, we weren't able to speak to as many people as we'd wanted to. And that's one of the reasons why we wanted to share our preliminary findings here so that we can capture more perspectives from the audience here. But overall, 4 main themes came up around sort of barriers or barriers to the fast implementation of digital health strategies. The first one was around a lack of high-level political commitment around digital health. So the lack of leadership to coordinate all of the government departments and non-governmental actors that need to work together to deliver the digital health strategy. It's not something that can be done by just the health ministry alone. And also that leadership to mobilize the necessary resources to finance the plan. The second major sort of barrier was around underinvestment in the foundational infrastructure required for digital health. So in order to strengthen and make use of these health information systems and digital tools, some of the gaps around reliable energy, network connectivity, for example, need to be addressed with urgency. The sort of third level was the sort of the next layer up around the infrastructure, we called it, for digital health. So some of the gaps in creating the sort of standards and interoperability so that data that is being collected in different parts of the health system and by private sector, public sector can be shared and aggregated and used to support the decision making. And linked to that, there were sort of a number of interviewees who noted sort of low levels of digital literacy and skills that prevented health professionals and other stakeholders from making good use of the infrastructure. And then the fourth theme was around sort of lack of stakeholder engagement in the development of the digital health strategies. So many groups such as civil society, young people felt that they hadn't been fully involved in the development of the strategies. And then that resulted in insufficient ownership of the strategy. So people didn't feel like they had a stake to play in helping to implement it or holding others accountable. So I've just moved to the next slide and I'll say a bit about the special focus on young people. When we asked people, do you think that future digital health strategies should have a stronger focus on children and young people, the responses were quite divided. Some people were surprised that we even asked that question. They thought it was adding a sort of layer of complexity that wasn't necessary, and that these kind of strategies should look at a whole population group rather than fragmenting into different age groups, for example, or communities. But on the other hand, and you can see a quote on the next slide, other people actually thought, well, in future, I think it would be useful for strategies to talk about the particular needs of different population groups, in particular young people who are the main users of digital technologies, often faster adopters, but also have a specific set of needs and risks in relation to technology and data. So there were very sort of divided opinions, and it would be interesting to know what people here think. Another theme on the next slide is around the sort of focus of digital transformation. We missed that, but yeah, so there were some other themes around the focus of digital transformation, and it was clear that for these 10 countries in particular, when people are talking about digital transformation of the health sector, they're really thinking about health information systems, telemedicine, e-health. They're not thinking yet around some of these other things that come under the umbrella of digital health, such as augmented reality, artificial intelligence. These are things that will come later when levels of digital maturity grow. And there were also some discussions around how useful is it to have a digital health strategy in the first place if it often just sits on the shelf. And here the perspectives we heard were that it is actually very helpful to develop a digital health strategy because it can bring lots of different actors together behind a common vision. But where they fall short is where it hasn't been a fully inclusive process, and perhaps when the strategies are just too over-ambitious, when there aren't the resources and the people available to implement it. So to wrap up, we just came up with a set of sort of concluding themes and directions that potentially policymakers might take into consideration when developing the next round of a digital health strategy. So these were sort of to develop a more inclusive process for developing the strategies for the reason I've mentioned around strengthening ownership and accountability, increasing the chances of all the different actors supporting one common national digital health strategy. The second was around sort of getting that right balance between having an ambitious vision for digital transformation, but also being realistic with the available sort of level of digital maturity and the resources. The third was around sort of maintaining that focus on strengthening data repository and access and building the sort of foundations to enable that to work effectively. The fourth is around improving the digital health literacy and skills of health workers, but also of the communities that need to be empowered to play a role in sort of sharing data and holding sort of decision makers to account for an equitable digital transformation. And then finally, we'd love to see, you know, more strategies applying a really strong set of values and principles that are aligned to their commitments to UHC, but just making that much more explicit so that digital health transformations really do sort of achieve equity, human rights, and leave nobody behind. So I'll close there. Back to you, Njide.
Thank you so much, Louise. I think the report has really highlighted quite a number of pillars that we need to focus on. I'm sure people are thinking, you know, what is the relevance of, you know, looking at some of these digital strategies? I think for Africa especially, for the 10 countries that their strategies were reviewed, they have certain things in common. Of course, the number or the percentage of people under 5, the fact that the UHC coverage is well below the average for Sub-Saharan Africa, the fact that connectivity, use of internet is actually rising very quickly in some of these countries, as Christian has highlighted. And of course, again, the issue of poverty. And again, if you look at some of these countries, you would realize that, you know, the government has the role of developing the strategies and implementing it, but the implementation has to be done in conjunction with several stakeholders. You can look at the digital strategies as a kind of compass that guides the implementation, but towards achieving UHC, and especially for young people who in the future will inherit the system. So the focus is on how can we use digital technology, including the mobile technology, to drive digital transformations to achieve UHC. So these are really important discussions, and there's so much to learn from one another. There's so much similarities with the countries that have been looked at. And I have two really good panelists who would respond from their own point of view to some of what they've heard today, whether it aligns. And I'll start with you, Ousmane. Ousmane, you are a physician and a digital health expert, and you are currently working with PATH, who I know is doing quite a lot of work in digital space in Africa. Amongst your role, you've advised many ministries of health, including the Ministry of Health in Mali and DRC, about their approaches to digital transformation. What do you think? Do these findings ring through for you? Many countries seem to have a good digital health strategy on paper, but as we heard, quite a number of them are not implemented or sitting on the shelf. Ousmane, I think you prefer to speak in French. So for those listening, if you don't understand French, please click on your translation so you can hear what he's saying in English. Ousmane, over to you.
Merci bien, Njide. Bonjour à tout le monde, à tous les participants. C'est un plaisir pour moi de participer à cette session. Et ce que je peux dire, c'est que sur la mise en œuvre des stratégies qui restent très souvent au stade de papier, dans les tiroirs, je viens d'en faire l'expérience tout de suite. parce que j'ai été déconnecté à cause d'une coupure d'électricité. Je suis à Ouagadougou, dans la capitale du Burkina Faso. Et donc, je suis dans un hôtel censé être un hôtel 4 étoiles, et donc avec beaucoup de commodités. Je l'ai choisi pour ça. Et il y a eu une coupure, le groupe électrogène n'a pas fait le relais. Et donc, j'ai dû me connecter maintenant avec ma 3G et en roaming, ce qui va me coûter très, très cher. Donc, voilà un peu les conditions dans lesquelles un certain nombre de pays africains se trouvent. Et donc, et c'est une réalité pour nous de dire que oui, beaucoup de stratégies sont écrites dans nos pays, surtout dans les zones francophones, et il n'y a pas de mise en œuvre. Donc, moi, je suis entièrement d'accord avec les conclusions de l'étude. Et donc, je voudrais attirer l'attention sur, pour moi, le premier problème, c'est d'abord la problématique des pilotes en Afrique. Nous ne faisons que des projets pilotes en santé numérique. Donc, ce qui nous amène à ne pas avoir ce qu'on appelle un environnement stable, un environnement concret qui va permettre le développement des outils de santé numérique. La seconde chose, ce que j'ai aussi remarqué dans la discussion, c'est que quand on parle santé numérique, la plupart des pays africains, on va parler télémédecine. Alors, ce n'est pas la télémédecine, la santé numérique, c'est tout ce qu'il y a autour. On dirait même, oui, on a commencé dans beaucoup de pays, c'est le cas du Mali, comme pour moi-même, nous avons commencé à faire de la télémédecine parce qu'elle est spectaculaire, elle permet aux décideurs d'avoir l'œil sur la question. Mais la première question et la première chose que nous devons faire dans nos systèmes de santé, c'est d'informatiser, c'est de faire une transformation digitale des process et des processus qui se trouvent dans nos systèmes de santé. Et là, tout ce qu'on veut faire va s'appliquer là-dessus. Parce que si on prend l'exemple de la télémédecine, faire de la télémédecine, c'est faire quoi? C'est de faire circuler, voyager l'information sur le patient. Donc, on ne peut pas faire de télémédecine sans commencer par numériser, digitaliser les informations du patient. Alors, je dis en ce moment dans tous les pays, au lieu de faire des programmes de télémédecine, commencez par informatiser vos structures de santé, commencez par faire un dossier de santé informatisé pour chaque patient qui arrive. Ça va améliorer les services de prestation, ça va améliorer ce qu'on appelle les aspects de gestion administrative, les aspects de gestion financière, ça va améliorer les aspects liés même à la gestion de l'assurance maladie, la couverture universelle sanitaire, et on fera une très bonne télémédecine avec. Mais très souvent, on inverse les choses. Si on prend seulement aussi les systèmes d'information sanitaire, aujourd'hui, tout le monde se plaint de la qualité des données des systèmes d'information de santé en Afrique. Oui, parce que nous faisons quelque chose, c'est nous faisons des formulaires pour juste aller capter des indicateurs. Et donc, or, nous ne travaillons pas sur la santé des personnes humaines. Or, si nous travaillons sur la santé des personnes humaines, nous pourrons faire ce qu'on appelle l'extraction automatique des indicateurs de santé et nous pourrons faire tout ce qu'il y a derrière, c'est-à-dire l'intelligence artificielle, on pourra faire le blockchain, tout ce qu'il faut pour améliorer la santé des populations, pour améliorer les données de santé. Donc, oui, je suis d'accord avec la conclusion de l'étude et je demande à ce qu'on aille plus avant, que l'étude ne soit pas, encore une fois de plus, une étude de plus, mais que ce soit un point de départ pour dire que non, arrêtons les pilotes en Afrique, partons vers ce qu'on appelle l'industrialisation de la santé numérique dans nos pays. Et ça, les décideurs peuvent le faire parce que c'est une question de décision politique. Merci.
Thank you so much, Usman. I think those are very valid points. As you were talking, all I could think about was Maslow's hierarchy of needs. When you transpose that into the digital space, at the baseline, there's certain things that need to happen, which include having electricity, as you said. Without it, you can't even get started. Then, there's the connectivity, the broadband. So there's a layer of infrastructure that needs to be in place before you even begin to layer on the applications and other things that you need to achieve or implement the digital health strategies. And even having said that, is something else you touched on, which I think is very important that people should be aware of, are the differences, the difference between digitization, digitalization, and digital transformation. I mean, each one of these words are very, very unique in terms of what it represents. Right now, we are mostly manual. Manual means paper-based, individual-driven, processes that, you have to activate the process by an individual. Digitization is now when you begin to transform those paper trail into a digital, digitizing it into a digital format, such as appointments, EMR, and this is somewhat process-driven, and the responsibility of different stakeholders, including the healthcare providers, and this creates a lot of efficiency. Digitalization somehow is user-driven. The patient journey, you go and make your appointment online. You allow for integration of different stakeholders, and this is where, if you don't have all these processes in place, then it's very difficult to implement a digital strategy. Now, of course, the big deal is the digital transformation, the likes of the Ubers, what Uber has done, Airbnb, and so on and so forth. This is now where the patient is in the middle of all the digital activities that is going on and in charge of their own healthcare. But let me jump over to Eno, because I know you are a clinician. You specialize in child and adolescent health, and you're also a leader in advocating for meaningful youth engagement. I mean, it's not surprising that, the questions were asked, why should we be talking to the youth? But at the end of the day, the youth will inherit whatever system we have in place now. So in your view, what do you think, what are the strategies we can use to engage the youth? How can we involve them in the development of some of these strategies? Can I have your opinion, or maybe your experience from implementing and supporting this process?
Thank you very much, Jide, for giving me the floor. I must say that it does not really surprise me that young people do not feature in the digital health strategies. For a long time, young people have always been seen as indirect beneficiaries of programs, and oftentimes even relegated upon. And so if you ask me how an ideal world would look like for young people, I would say that young people should not only be beneficiaries of programs, but also active partakers in the development of the programs. They should be included at every step of the process. We need to directly consult with youth and ensure their voice is included in every step of the design, development, implementation, and even evaluation of the digital health strategies. Because you can't do something for young people without involving young people. If they are the ones that will inherit the digital health technologies in the future, they must be actively involved from the design process. So I will go with the say that nothing for young people without young people. And if you ask me how can this be possible, I will say, one, create active roles for youth within the design process. Two, build a youth mentorship infrastructure where young people can learn, can become digitally literate. And three, clarify the process for youth to participate in the digital health strategies. I think if we target on these three interventions, young people will be meaningfully engaged in the process and will be actively involved in issues that directly concerns them. Thank you.
Thank you, Eno. Very, very valid point. It reminds me about this time last year, I organized a youth consultation in Nigeria, just as a way of supporting the work of the Lancet. We invited about 140 youth to come and brainstorm and tell us how they imagine their health in the future. And it was, even I was shocked at the kinds of responses and information that they were passing on. One, for example, is the fact that, they are one of the most vulnerable population, and they're never covered by any kind of health insurance, because when you turn 18, they say, well, you're too old to be covered by your parents' insurance, but yet you're too young. You don't have a job, so you're left floating. Two is mental health and reproductive health. Family planning is hardly ever covered in the benefit package, and that is what they need the most. 3 is the fact that they have a lot of ideas and devices, and they have a lot of innovations, but they never have access to finance to scale some of those innovations. They are never given a seat at the table. 4 is, of course, the regulators don't even recognize that they exist, yet they are in the majority. So these are some of the things that the Commission is looking at and trying to harness ideas on how government policies, government regulators can be engaged so that the youth actually recognized and consulted as these policies are developed. Now, I don't know if the audience have any questions, but I have a few which I'm going to throw back at the panelists in no specific order. Luis, I know you have done quite a bit of work trying to get these interviews and to research some of these strategies. What do you think are the kinds of values and principles that should really be core? That is, in every digital strategy you looked at, should there be specific pillars that must be included? Should this be the kind of activity that could potentially be driven by an African Union to bring together the countries to align in terms of implementation? What are your thoughts around what you've seen and how some of these digital strategies can be improved?
Okay, thanks for that question. I think the Commission has given a lot of thought to some of the, what we call the foundational entry points, some of the key values and principles that we think should underpin governance of digital health, and the presentations of outlined some of those. So equity is one that I think many countries have already really integrated into their approaches to digital health, at least at the sort of policy level. So the question is, how do we make sure that everybody involved in digital transformation of health, whether that's in the health sector or other digital health actors who may have an impact on health outcomes, are thinking about equity, equity in terms of who they're designing with, who they're designing digital tools for, to make sure that sort of everybody can benefit equally. And then some of the other sort of principles that we think are really important are around human rights. So as I'm sure everybody knows, particularly with COVID-19, there's been a lot more awareness about some of the ways in which digital transformation technologies and data can potentially harm or help, such as privacy and confidentiality. So I think these are the kind of things that we want everybody involved in digital health to be thinking about. Inclusion is another important one, which Enno was talking about. So there's lots of key, like foundational documents like the Convention on the Rights of the Child that countries have signed up to, that talk about the right of children to be involved in decisions that affect their lives. So how are we going to sort of put those kind of commitments into practice in digital health? So that's just a few examples. And I think bodies like the Africa Union can play a really important role in sort of reiterating what kind of priorities should be included in digital health strategies. Obviously, they're going to be different for every country and every context, but there might be some sort of key elements that should be similar across all of them.
Yeah, very, very important. Christian, also, as you were reviewing some of the strategies, were there actors you felt that needed to be engaged that were not engaged? That's the first question. The second one is, being myself from Nigeria, which is, of course, in Africa, the largest, the country with the largest population, there is the adoption of and the use of mobile phones is so central to our existence. Is there any mention of mobile technology in some of these strategies, or how can we make sure that there is a recognition of the power of this kind of strategy, and how can we bring this all together with making sure the right stakeholders are at the table?
Yeah, thanks so much, Ndide. And to your first question, like which actors should be engaged. And so I think what we heard from some of the interviews, especially, like actually there was an interview with a person from the private sector in Nigeria. So they were saying, yes, digital strategy is nice, but if I remember correctly, this person said, this strategy was really developed before the digital ecosystem had really kicked off in Nigeria. So she said, well, actually, we would have to rewrite the whole thing right now, and but no one has asked them so far. So I think it is extremely difficult, I think, to write such a strategy in a very quickly developing field. But that is true for all policymakers around the world. But I think that an active process of engaging, let's say, startups, the innovation landscape, I would say, in all those countries at an earlier stage would help the policymakers to stay on top of the developments a bit more. So that was for the first question. I think that is important to not just nurture this innovation environment, but also leverage it, right? And the second part, the adoption of mobile phones. Yeah, here I need to self-critically ask myself about the work that we have been researching. Like, what are we, like we call it digital health strategies, right? But that is not actually the case in most of these countries. I think I had a conversation with you, Njide, about a similar aspect. And it might actually be one of those bits and pieces where those countries can innovate beyond everything that is done outside of Africa, to be honest. Because here is something that is used so much and that has worked in digital payments. Like, how amazing is that? I can tell you from Berlin, where I am based, it took the pandemic for most shops to accept electronic payment. So until then, it was not there. So I think that is something that is truly unique, and that can be, again, leveraged, I believe.
Interesting. So Usman, but this question is for you in terms of what you were seeing digital transformation-wise with the advent of COVID, with your work in PATS. You know, are there any examples you can give that COVID has really helped accelerate towards UHC in Mali or DRC?
Merci bien. Oui, effectivement, Covid a accéléré l'utilisation des outils numériques dans tous les pays. Mais ce que Covid a accéléré, moi j'ai bien peur que ça n'ait pas un résultat à long terme. Covid a accéléré le développement des outils de type formulaire. C'est-à-dire, on fait un formulaire de check pour Covid, on fait un formulaire de suivi de contact tracing, on fait un formulaire pour enregistrer ceux qui arrivent à l'aéroport, on fait un formulaire pour ceux qui vont aller faire le test positif ou négatif. Non, avec Covid, on a eu une utilisation comme ça fragmentaire de la technologie pour la santé. Et ça, ce n'est pas durable au sorti de Covid. Ça a été exactement la même chose avec Ebola en Afrique de l'Ouest en 2014 et en RDC et les différentes séries d'épidémies d'Ebola. Nous amenons des outils numériques juste pour le problème ponctuel, événementiel. Or, on a besoin de transformer sérieusement nos systèmes de santé. Alors, ce que ça a fait, c'est que les décideurs ont compris que c'est important d'utiliser les outils numériques. Covid a amené ça. Donc, du coup, l'utilisation de la visioconférence est généralisée. Les plateformes qui ont été développées pour Covid sont généralisées et les populations ont commencé à utiliser. Mais ce que nous devons arriver maintenant à faire, c'est de leur dire que c'est tout le système de santé qui a besoin de ces outils numériques. Que tous les processus doivent être transformés. On ne doit pas s'en arrêter juste à COVID-19 parce que des COVID-19, on en aura. Ce n'est que le début. Ça avait été prédit que les virus vont sortir de la forêt et ils sont sortis et nos moyens de communication font que de déplacements font que on aura encore face à d'autres pandémies. Ce n'est pas être pessimiste, Mais c'est de la réalité. Nous confrontons à ces virus-là. Donc, nous devons être prêts. Et transformer digitalement nos systèmes de santé est un bon point. Et je reste convaincu que la prochaine étape que nous devons faire, c'est que tous les citoyens doivent avoir leur dossier de santé numérisé. Parce que c'est ça, nous devons tous centrer sur l'utilisateur, sur le citoyen, sur le patient. Et donc, quand nous faisons ça, c'est lui qui fait Covid, c'est lui qui fait le paludisme. Parce que quand nous regardons aujourd'hui en Afrique, on va regarder les résultats après. Les gens ont fait plus de malaria pendant cette période Covid que de Covid. Et pourtant, Covid a impacté tous les traitements de paludisme. Les gens n'ont plus eu accès aux médicaments parce que les transports se sont arrêtés. Les gens ont souvent eu des problèmes de difficultés de traitement pour les malarias parce que tout simplement, il y a eu des confinements dans certains endroits. Et donc, il n'y avait pas de mécanisme, la logistique derrière pour dire quand ça s'arrête, comment on fait pour leur donner leurs médicaments de paludisme, de malaria. Alors, voilà un peu des réalités. Donc, Covid a montré que la technologie, c'est bon, on peut l'utiliser pour résoudre les problèmes, mais aussi Covid a démontré que cette technologie doit être utilisée pas juste pour une maladie, mais pour l'ensemble des maladies. Et donc, si nous devons l'utiliser pour l'ensemble des maladies, on doit l'utiliser juste pour la personne humaine. Donc, ça doit nous ramener à centrer nos systèmes de santé, à centrer nos interventions de santé numérique sur la personne humaine et nous serons tous gagnants par rapport à cela. Merci.
Valid points again. I think that with COVID, what the mobile phone has done and digital communication is to be able to allay, the disinformation. There was a lot of disinformation, so it's easy to send out messages and people get it even on their feature phones. So I think you're very right. More people were dying from other ailments, not COVID, but again, this is just to show the importance of having a digital strategy and implementing a digital process that can link all the different health systems together for us to harness the information. Without the information, we're not going to get very far. So over to you, Eno. I think you made some valid points about, engaging the youth and having, the regulators and the leadership of government should develop mentorship infrastructure.
Have we lost Njide?
I think so. Eno, maybe you can anticipate what she might have said.
I didn't get her to the end.
Can you hear me? Am I the one who dropped off?
Yes, I think you dropped for a second.
We lost you there for a moment.
But did you hear my question?
No,
so let me be brief in case I drop off again. So I was asking the advice you would give to the youth so that they are better positioned to be engaged as opposed to the other way around, because they have to put themselves forward. What advice would you give to the youth so that they are?
Thank you very much. I would say the young people, they have to become digitally literate. They must make informed choices and decisions. They must know what it is. They must understand digital literacy. They must educate themselves and build their capacity, because many a times we want to sit on the table. We want to make the decisions, but are we informed enough? Do we know, do we have the data, the knowledge on digital health transformation? So my advice to young people will be for them to become informed, to build their capacity on digital health technologies, so they can better take decisions that will directly influence their life and in the future to come.
Okay, I think we have just 5 minutes left. So I'm going to do a quick round. If you can give me one last thought, 1 minute response to what you think the priority action for governments should be to make sure that digital health strategies are transformed into action. I'll start with you, Louise.
Okay. I think for me, the main thing that needs to be done is to have a really inclusive process of either developing a strategy, or if it's already been developed, then bringing all those groups, you know, young people, different communities, private sector, the donors, and like everyone together, so that they can help assess, you know, whether the strategy is realistic, what are the gaps in terms of implementing it, but then also so that more people feel that sense of ownership, so that they can all help to implement it, and hold, you know, all of the different people accountable, so they can say to the people who need to provide the reliable energy supply, this is what you need to do, and so on and so forth. I think that's the main thing I'd like to see.
Christian?
Yeah, so I think for me, it would be wonderful to see how the countries lead a bit this innovation and the digital transformation. And I personally was very much inspired by the Ugandan example of reining in all those pilots, and by simply stating, first you come to us and we give you the agenda that we have, instead of you bringing your agenda and just trying another pilot.
Very valid. Usman?
Alors, moi, ce que je voudrais dire, c'est que il ne peut pas y avoir de couverture sanitaire universelle sans transformation digitale de nos systèmes de santé. Parce que pour que la couverture sanitaire universelle puisse réussir, c'est un système d'assurance, il faut qu'il y ait une gestion efficace et efficiente de nos systèmes de santé. Il faut qu'on puisse savoir qui a droit à quelle prestation et qui a fait quelle prestation, où et quand, et combien ça a coûté cette prestation et qui doit être remboursé par rapport à cette prestation. Nous ne pouvons pas faire cela avec nos systèmes manuels. Nous ne pouvons pas arriver avec le système papier à l'efficience et aux résultats estimés. D'autant plus que nous sommes en train d'évoluer vers la médecine personnalisée. Parce qu'aucun individu sur Terre n'est égal à l'autre. Même les vrais jumeaux sont différents. S'ils ont été élevés dans des environnements différents, ils ne vont pas faire les maladies de la même manière. Donc, de ce fait, une transformation digitale avec une utilisation accrue de l'intelligence artificielle et de toutes ces évolutions technologiques que nous avons entre nos mains, qui ne seront plus juste l'apanage des pays développés, mais pour nous, les pays qui sont en développement, nous permettant de faire le leapfrog, c'est-à-dire le saut de grue. Parce que si nous regardons le temps que les outils de communication comme le téléphone a mis en place pour avoir tous les foyers en Amérique, et le temps que ça a mis en Afrique pour atteindre la masse critique nécessaire avec la téléphonie mobile, nous sommes vraiment en train d'évoluer à la vitesse de la lumière. Donc, pour moi, pas de couverture sanitaire universelle sans transformation digitale de nos systèmes de santé. Il faut que les décideurs viennent à cela et que nous tous, de manière inclusive, on l'accompagne. Merci.
Very valid. And over to you.
Thank you.
You have the last word for now.
Yes, I will call on governments to engage youth in the design, development, implementation, and evaluation of policies, systems, tools, and technologies that are related to digital health technology.
Well, Christian, you have one more point to make? Oh, okay. Yeah, so I think, we have a long way to go, if I put it as simple as that. When we look at our statistics and what is going on in the rest of the world, we have a lot to learn, but we can leapfrog. I think leapfrog is the word. We don't have to go through the pain that the rest of the developed countries have gone through to get to where we are. One thing is for sure, we cannot achieve universal health coverage without the use of digital technology as an enabler. 60% of African youth are not digitally connected when you compare them to 4% of Europe that are not connected. So we still have a long way to go. But the most important thing is that we engage the government, we engage the leadership, which is why review of this digital strategy is very key. Again, I'd like to, I think we're almost out of time. I'd like to thank all the participants that have joined us, to thank the panelists so much for their insights and their contribution, and to say that the Lancet report which would include some of these findings, will be published in September. I think that if you have any experience you'd like to share with us, please reach out to us. You can also click on the barcode. We have a virtual booth, so you can go and learn about what the Commission is doing. But most importantly, Africa must take ownership of its processes to use digital to transform the lives of people to achieve UHC and the well-being of the young people. Again, thank you so much, and have a good day. Enjoy the rest of the conference. Thank you. I think our time is up, so thank you.
Thank you, Ndidi.
Thank you.
Au revoir.
Thank you so
Merci.
much. Bye.
Bye bye.